Case numbers are rising in the Los Angeles area, just as hospitals are reopening for elective procedures, and that could cause a bed shortage there. That's why Dr. Hector Flores of Adventist Health White Memorial Hospital wants the state to extend funding of surge hospitals past June 30th. Dr. Flores, thank you for joining us tonight. Why is this necessary to do right now?
Thank you for having us. Well, we're seeing a change in certainly in Southern California, where hospitals in the first 90 days of the pandemic following the emergency declaration conserved as much space as possible. And they were at 40 to 50% occupancy, giving us confidence that there would be enough beds available for a surge. What is happening, there are two parts. One is that we're seeing patients that were elective surgeries 3 months ago are now becoming urgencies or even emergencies. And we cannot afford to continue to have that pattern because more and more people will be hurt. The second thing is that hospitals are under tremendous financial stress, and their bread and butter is elective cases, surgeries, colonoscopies, other procedures that keep people healthy. And if we don't open them up, we could actually have a collapse of the hospitals. So in the first 90 days, it was 40 to 50% occupancy. As we begin to deal with those urgent cases and what we call essential cases, hospital census now are going up to 80%, 85%. So now we're limited in the smaller number of beds available for a surge. These surge hospitals were implemented in April of this year, and they actually were underutilized because we had tremendous success in shelter-at-home strategies. But now that we need to open up the economy, I think we're going to see the need for those surge hospitals.
Clearly, this is an issue of cost. I guess the pushback, doctor, would be that even in New York, which saw a crisis-level outbreak and hospitals get full, we had the Javits Center, the big convention center, the SHIP, the USNS Comfort came to house the spillover cases, and both were not really used. So what would be the case for LA to do that at this point?
I think the case would be, despite the prohibitive cost, is that we are seeing an uptick in cases across the Southland. You may have heard in Ventura County, which is just north of Los Angeles, and Orange County, just south of us, when they reopened their beaches, hiking trails, parks, et cetera, during the Memorial Day weekend, we're now seeing the impact of people clustering together, sadly, oftentimes not keeping that safe distance, oftentimes not using masks. And they don't realize that they may be otherwise healthy and have minimal symptoms, but they're taking that disease home to the elderly relatives in their home. So we need to be able to anticipate something similar in Los Angeles County. Across the country, we have seen a tremendous amount of protests, civil disturbance, people say, again, congregating, and sadly, that could be an exposure situation that we need to anticipate.
How quickly can these surge hospitals get up and running if needed?
Currently, we have one surge hospital in Los Angeles County scheduled to close at the end of June, so June 30th. So it's currently in place. So it's really making a commitment to continue to fund its availability as we see what rolls out over the next couple of weeks. There was another hospital in the southern part of Los Angeles County in an area called Long Beach. It's a community hospital that was also being considered to be a surge hospital. So we're looking at those one being open, keeping it open, and potentially having the other one ready to go in case it's needed.